Welcome to the Deep Dive. Today, we're plunging into the world of healthcare accreditation.
We are. You, the learner, shared a really great set of sources, and we've pulled out the key stuff from places like Joint Commission International, JCI.
Right? And NABH in India, ISQA, plus that research article on impact and some other bits and pieces.
Exactly. So our mission for you today is to really get a grip on what healthcare accreditation actually is, why it matters.
And what happens after an organization gets it. Because it doesn't stop there.
Not at all. It's your shortcut, basically, to being well-informed on something pretty vital in healthcare and maybe uncover a few surprising things along the way.
Okay, let's unpack this landscape then. There are some big names that pop up immediately. JCI, Joint Commission International, they seem like a major global player.
Oh, absolutely. They're really seen as a leader worldwide for healthcare quality and especially patient safety.
And their reach is huge. Over 70 countries.
Yeah. Massive. Asia, Europe, the Middle East, Africa, Latin America. They're everywhere. And they've accredited or certified, I think, over 1,000 programs now.
Wow. And it's not just the main accreditation, is it? They do more.
Right. That's what's interesting. They also have specific certifications, like for clinical care programs, and even things like healthcare sustainability and telehealth, which, shows how they're adapting.
That's really current.
Plus, advisory services, education. They're quite involved. And they've got that big Unify 2025 conference coming up in D.C. next year.
Keep some momentum going.
Okay,
then there's NABH. That's the National Accreditation Board for Hospitals and Healthcare Providers.
Yep, based in India, part of the Quality Council of India.
And their focus is purely on India, setting up accreditation there.
Pretty much, catering to the needs there, setting benchmarks for the Indian health industry. And they have this thing called functional autonomy.
Functional autonomy. What does that actually mean in practice? Like independence?
Essentially, yeah. It means even though they're part of the bigger Quality Council, NABH can make its own calls on standards and processes. Helps keep things impartial, builds trust.
Got it. Okay. And the third big one mentioned is ISQA, International Society for Quality in Healthcare.
Right, ISQA. They're a bit different, member-based, nonprofit, been around for, over 30 years?
And their focus is more on promoting quality improvement generally.
Exactly. Through education, sharing knowledge, external evaluations, supporting health systems, connecting people.
So more like a network or a hub.
Very much so. That global network across 70 countries is key. They're a central point for quality efforts. And their conferences, Sao Paulo in 25, Dublin 26, are big deals for sharing what's new.
Okay, so we have these big players setting the stage. But what is accreditation fundamentally for a hospital or clinic?
Well, the key thing is it's voluntary. An organization chooses to have external reviewers, peers, usually come in.
Right, and these reviewers check how well the organization meets certain preset standards.
Exactly. And it's different from, say, certification, which can be for individuals too, not just organizations.
And definitely different from licensure, which is the basic government permission slip to operate, right? Usually minimum standards.
Precisely. Licensure is mandatory. Accreditation is generally voluntary.
Which begs the question, why do it? If it's voluntary and probably pretty demanding.
That's the million-dollar question, isn't it? I mean, the history shows it started formally in the U.S. with JCAH, now the Joint Commission, back in 51.
And then spread globally. So there must be real perceived benefits.
Absolutely. And the sources give us some concrete examples. Burjeel Farha Hospital mentioned a competitive edge, building community confidence.
And better risk management, too.
Yeah. Emirates Specialty Hospital talked about boosting patient confidence in their treatment. Corniche Hospital saw it as showing their commitment to excellence, meeting international standards.
And Hong Kong Adventist hospitals even found it helped with team building and internal communication.
Right. It's not just an external badge. The process itself seems to improve how things work internally.
That focus on patient safety comes up again and again, too.
Yeah.
Like Burjeel Farha mentioning creating a patient safety culture.
That's critical. It seems to be a core driver and a core outcome. It makes the abstract idea of quality much more tangible.
Okay, so those are the reasons why hospitals might go for it. But let's dig into the evidence. Does it actually work? What's the impact?
Good question. We looked at that systematic review, 26 studies between 96 and 09, trying to measure the impact on quality.
And what did it find? Did it distinguish between different types of accreditation?
It did, yeah. It looked at general accreditation, like for the whole hospital versus subspecialty accreditation for specific departments or services.
Okay. And for general accreditation?
The main finding, pretty consistently across most studies, was that it significantly improves the process of care.
The process, meaning how things are organized.
Yeah, like the structure, the organization of the facility, making sure things run smoothly, protocols are followed, like a well-oiled machine.
Does that translate into better results for patients, though? Better clinical outcomes?
Well, the review suggests, yes, there's considerable evidence for that too, for several conditions.
Like what?
Things like acute myocardial infarction, heart attacks, trauma care, ambulatory surgery, infection control, even pain management. So, yes, impacting actual patient health.
That's pretty significant. What about the subspecialty accreditation? Does that also help?
Similar story there. Also, a significant positive impact on clinical outcomes in areas like sleep medicine, chest pain centers, trauma management.
Chest pain centers. I remember reading that accreditation there was linked to better following of guidelines for heart attacks.
Exactly. Better adherence to AMI guidelines, higher rates of PCI, that crucial intervention.
And there was something about vascular labs, too. Non-accredited ones making mistakes.
Yeah, significant errors overestimating or underestimating carotid artery stenosis. So specialized accreditation seems really important for accuracy in specific fields.
But it wasn't all positive, was it? The research found some nuances.
Right, important caveats. Some studies found weaker links or, no clear correlation between general accreditation and certain outcomes or even patient satisfaction scores sometimes.
So it's not automatic. Accreditation doesn't guarantee perfection.
Precisely. It suggests the details matter a lot. How rigorous are the standards? How specific? And crucially, how well are they actually implemented day to day?
Implementation is key.
Definitely. The review even mentioned one study where a fair number of low-performing health plans still had accreditation.
Oof. Okay. So it's a tool, a framework, but you have to use it right.
Exactly. It's not a destination. It's very much a journey. Which leads us nicely into what happens after you get accredited.
Right. So you've done the hard work, passed the surveys. Now what? Kick back and relax.
Definitely not. The sources are really clear. Getting accredited is just the start. Maintaining that quality is an ongoing effort. Continuous commitment.
It has to be, doesn't it? Healthcare changes so fast.
Constantly. New research, new tech, patient needs evolve. You have to build that improvement culture into your DNA.
So what are the key strategies for doing that, for keeping the momentum going post-accreditation?
Well, number one is probably continuous quality improvement, CQI.
CQI. That means?
Regularly looking at your processes, using data, using feedback to find areas to improve, and benchmarking.
Benchmarking, comparing yourself to the best.
Exactly. Seeing how top performers handle, say, infection control and learning from them.
Makes sense.
Yeah.
What else? Patient safety must still be huge.
Absolutely central. Sustaining that safety culture, actively preventing errors, managing adverse events properly, clear communication.
So doing regular safety audits, analyzing incidents, that becomes even more important.
Critical. You can't let things slip just because the surveyors aren't there right now.
And staff training. That can't stop either.
No way. Ongoing education is vital. Best practices change, new equipment comes in, infection control protocols get updated. You need constant learning.
Okay. And audits. You mentioned safety audits, but there are others.
Yep. Regular internal audits, checking yourselves against the standards, and then the external audits for reaccreditation. They keep you honest.
Find those areas where maybe things aren't quite up to scratch anymore.
Right. And data helps pinpoint those too. Tracking key performance indicators, KPIs.
The metrics. So you can actually measure progress.
And make informed decisions, yeah. Not just relying on gut feelings about quality. Using the actual numbers.
That sounds crucial. What about involving people? Staff and patients.
Super important according to the sources, getting their feedback through surveys, having them on quality councils. Their perspectives are invaluable.
They're the ones on the front lines or receiving the care after all.
Exactly. And finally, kind of obviously, you have to stay current with the accreditation standards themselves. They change.
Right. The goalposts can move. So you need to keep adapting your own processes.
You do. And underpinning all of this is documentation.
The paperwork.
Well, yeah, but it's essential. Detailed records of processes, training, audits, improvements, performance data.
It proves you're still compliant for reassessment, which is every few years.
Typically 3 to 5 years, yeah. But it's more than that. It builds that institutional memory, supports continuous learning. It's the evidence base for improvement.
Okay, so stepping back again, the big picture. This accreditation thing is a serious global effort.
It really is. Organizations like JCI and ISQA are driving this push for better quality and safety worldwide. It's not just a US thing or a Western thing anymore.
And there's help available for hospitals trying to do this, like consultants.
Yeah, the mention of services like Supremedic shows there's practical support out there. You don't necessarily have to figure it all out alone.
Which is good, because it sounds complex, and maybe sometimes staff are a bit skeptical about it all.
That can happen. The research hinted at that. So education and clear communication about why the benefits for patients and staff are really important to get buy-in.
Makes sense. And the ultimate aim. What's the big goal here?
Well, organizations like JCI talk about driving towards zero harm, highly reliable care.
Zero harm. That's ambitious.
Incredibly ambitious, but that's the direction, right? Minimizing, ideally eliminating preventable harm. Making care consistently safe and effective. A huge goal for the whole industry.
Okay, so wrapping up our deep dive today. Accreditation is voluntary, but it seems pretty impactful. Focus squarely on improving care quality and patient safety.
Yeah, and getting that initial accreditation is a big deal, no doubt. But the real work is maintaining it, that continuous journey.
Need strong systems, ongoing effort, and crucially, getting everyone involved, staff, patients.
Absolutely. And the research shows it can lead to better processes and clinical outcomes.
But it's not automatic. The standards need to be rigorous, and they need to be implemented really well.
Implementation is everything. So that leaves us with a final thought for you, the learner.
Given all the effort and resources that go into this, how can you, as a patient or member of the public, actually use this information about accreditation?
Yeah, how can you factor it into your healthcare decisions? And maybe what questions should you be asking a hospital or clinic about their own accreditation journey?
Something to think about next time you're looking at healthcare options. Definitely food for thought.